Hi everyone, welcome to week 10, your final week of your pharmacy software course. This week you're going to be completing labs 19 and 20. And if you notice just prior to turning to page 132, if you look on page 131, you'll see that this section is called the assessment section. So what that means is this is kind of a way for you to test yourself and to check your skills, the things that you've learned over the last 10 weeks. So the first lab is all about community pharmacy. So what you're going to be looking at is just all those different skills that you've learned as far as entering new prescriptions, processing those for customer pickup, refills and how to process those, things like prior approval, refill authorization, billing, making sure that the correct medicines and patient are all chosen when you're in there doing that, etc., etc. As you look through the directions for this lab, of course, they're going to ask you to go ahead and fill that prescription, which is something you're not able to do. But you can do the first 3 steps. So you are going to use the prescriptions and simulate that whole process of preparing the label, etc., etc. You're going to input all the data. And all of that good stuff. So as you're going through those new prescriptions on pages 133 all the way up through page 136, if you have any questions about, what does the SIG say? I don't understand that that terminology, or I don't know how many to fill it with based on the prescription that they're giving. Anything along those lines, please make sure you reach out to me and I will help you with that. Don't just put anything down. This is for you to practice. Now, on that note, you're also not turning anything in this weekend, so this is strictly for you. But keep in mind that with your final exam, any questions from this material is fair game. So make sure that you've gone through and done these practices before you attempt the final exam. The same with the refills requested on page 137, same idea. And notice on this one, and I like this a lot, that they have things like, for example, on number 2 for Patricia Armstrong, refill her GERD medication. So when you're on here and you're looking to refill a prescription, you're going to need to figure out, well, what is her GERD medication, right? So the first thing we're going to want to do is we're going to want to look up Patricia Armstrong. So, we're going to do a little search for Patricia and see what exactly is she getting. Okay, so we can look and see what are some of her prescriptions that she's currently got. What are some of the prescriptions we've filled for her in the past? So this is something that you're going to want to make sure that you do, and you're going to want to look and see, okay, I see some medications. What are those for? So you're going to want to take a moment to look those up. And there's several of them like that on here. When you get down to James Rowan, his are described that way as well. Now, the second lab that you're going to be doing is an institutional pharmacy review. So this is going to be the skills that you learned on entering IV orders for the most part. So you're going to be going through, and even though the orders contain a lot of other stuff, you need to be able to look for just the intravenous medication. So you're just preparing the labels for the IVs. So you're going to want to be able to go through this and say, okay, what exactly is the IV? Where is that at on this doctor's order? So for example, when you look on page 139 at Floyd Ellis, they're again telling you a lot of things about him, everything from his height and weight to his diagnosis, to who's his attending physician, all of that good stuff. They're telling you about his vitals, what he's allowed to do as far as activities go and things like that, what labs they've had ordered, and then they're going to tell you about the IVs. So some of these are IV medications, some of them are oral medications. According to the directions, you're only creating the labels or, inputting the prescriptions for the IV medications. So don't worry about the ones that are oral. Make sure you're just doing the IVs as you go through this. If you have trouble discerning which ones are which, again, please let me know. I'm happy to help you work through these. And if you have any questions at all before you take the final exam, please make sure that you reach out to me. And have a great week, and it's been a pleasure having you in the course.